Some of you may have heard about Trudhesa DHE nasal spray and thought that no different from other traditional DHE nasal sprays. The truth is, unlike traditional nasal sprays, Trudhesa uses precision olfactory delivery, or POD, technology to gently and consistently deliver DHE to the upper nasal space. Now in the past, this space in the nasal cavity has been difficult to consistently access, but POD uses a manually actuated propellant to deliver DHE to this area. And what does that mean for your patients? The upper nasal space is highly permeable. Delivery to this space allows the drug to enter the bloodstream quickly and increases bioavailability compared to traditional DHE nasal spray, creating an opportunity for rapid uptake and rapid relief. Consider too that most patients with migraine may have gastric dysmotility, which includes delayed emptying of the stomach, and may affect approximately 80% of patients with migraine. 80%. Think of your patients who experience nausea and vomiting. A non-oral route of administration can avoid GI tract degradation and first-pass metabolism to provide rapid, reliable relief patients need. Now think of Trudhesa, which is different from anything we've seen before because of where it is delivered and how quickly and consistently it works. Trudhesa is able to circumvent GI issues, and with the advanced technology of POD, Trudhesa is able to deliver medication to the optimal upper nasal space for rapid, consistent absorption of highly effective DHE. For patients with migraine who experience nausea and other GI issues, consider Trudhesa to deliver rapid, reliable relief.
Indication and important safety information. Indication. Trudhesa is an ergotamine derivative indicated for the acute treatment of migraine with or without aura in adults. Warning: peripheral ischemia following co-administration with potent CYP3A4 inhibitors. Serious and/or life-threatening peripheral ischemia has been associated with the co-administration of dihydroergotamine with strong CYP3A4 inhibitors. Because CYP3A4 inhibition elevates the serum levels of dihydroergotamine, the risk for vasospasm leading to cerebral ischemia and/or ischemia of the extremities is increased. Hence, concomitant use of Trudhesa with strong CYP3A4 inhibitors is contraindicated. Limitations of use. Trudhesa is not indicated for the preventive treatment of migraine or for the management of hemiplegic or basilar migraine. Contraindications. Trudhesa is not recommended in patients with concomitant use of strong CYP3A4 inhibitors, such as protease inhibitors, for example, ritonavir, nelfinavir, or indinavir, and macrolide antibiotics, for example, erythromycin or clarithromycin. Ischemic heart disease or coronary artery vasospasm, uncontrolled hypertension, known peripheral arterial diseases, sepsis, following vascular surgery, or severe hepatic or renal impairment, hypersensitivity to ergot alkaloids, concomitant use of other 5-HT1 agonists, for example, sumatriptan, or ergotamine-containing or ergot-type medications within 24 hours, concomitant use of peripheral and central vasoconstrictors. Warnings and precautions. Trudhesa may cause cardiac events in patients with risk factors of coronary artery diseases. Consider administration of the first dose of Trudhesa under medical supervision, including the use of an electrocardiogram. Cerebrovascular events. Cerebrovascular events, for example, cerebral hemorrhage, subarachnoid hemorrhage, and stroke, have been reported, particularly with dihydroergotamine mesylate injection. Vasospasm, elevated blood pressure. Dihydroergotamine may cause vasospasm or elevation in blood pressure. Fibrotic complications. Rare cases have been reported following prolonged daily use of dihydroergotamine mesylate. Administration of Trudhesa should not exceed the dosing guidelines or be used for chronic daily administration. Medication overuse headache. Detoxification may be necessary. Preterm labor. Advise pregnant women of the risk. Local irritation. Local irritation has been reported following administration of Trudhesa. Most common adverse reactions. Most common adverse reactions, incidence greater than 1%, were rhinitis, nausea, altered sense of taste, application site reactions, dizziness, vomiting, somnolence, pharyngitis, and diarrhea. Use in special populations. Pregnancy. Available data from published literature indicate an increased risk of preterm delivery with Trudhesa use during pregnancy. Lactation. Patients should not breastfeed during treatment with Trudhesa and for 3 days after the last dose. Please see the Trudhesa full prescribing information, including boxed warning and medication guide. The risk information provided here is not comprehensive. The FDA-approved product labeling can be found at www.trudhesahcp.com or 1-800-555-DRUG. You can also call 1-833-TRUDHESA, 1-833-878-3437 for additional information.